how do you care for a patient that has a chest tube? So, assessment. They have a chest tube because they're having issues with the lungs. That's very, very delicate. Okay. So, when you come into shift, assess the lung, assess the breathing, and make sure your patient always has this. This is the incentive spirometer, and it helps with breathing and expanding the lungs. They need this. They have to be using this. There's an order for this, and you have to be documenting to how much your patient is able to blow in it and take deep breathing. Okay. Very important. You also want to assess the site, okay? There will be gauze on the site. Is it draining? Is it dry? Make sure you assess because sometimes it can be leaking and you have to know what's happening. Or sometimes the chest tube will get dislodged. When it gets dislodged, it's a big emergency, right? What do you do when the chest tube gets dislodged? You always want to make sure when you have a patient that has a chest tube, you always want to make sure that you have gauze and you have sterile water. Okay, petroleum gauze is the preferred. I wasn't able to find the gauze, but hey, here is the gauze and you have sterile water. So when the chest tube gets dislodged, you want to cover the side with some sort of gauze, and then you want to put the other part into sterile water. You always want to notify the doctor. It's an emergency. When a chest tube that gets dislodged, it's an emergency. Keep the emergency equipment for in case when it gets dislodged at the bed comes, you want sterile water and you occlusive dressing. Okay, you never want to elevate the chest tube above the chest. You want to check the system connection frequently. It's the suction, it's connected to my patient, and it's doing what it's supposed to do. Yes, you want to always assess your patient first and not the chest tube. So this is it. If you have any questions, make sure you comment and you share this with your friends. You got this, guys. You learn, you're going to practice. Make sure you go to this open labs, go practice on your chest tube, and practice always makes perfect. So follow for more.